Hi, my name is Dorothy Kozlowski, and I am a professor of neuroscience and biology at DePaul University. And I'm also the co-founder and director of the Illinois Coalition to Address Intimate Partner Violence-Induced Brain Injury. And I thank you for watching this video, which is basically an introduction rather to the intersection of how domestic violence and brain injury interact. I will start by giving you a bit of a background on brain injury and its forms, and then we will talk a little bit about how intimate partner violence results in brain injury, and then lastly, how you, as someone who is interested in this field, can accommodate someone who has experienced brain injury to domestic violence. So with that, let's start by talking about brain injury. So your brain is basically a bunch of fat, and it moves around in your head like jello, and it floats in your head, and it's surrounded by a skull that isn't smooth inside. So when your head is hit, or something hits your head, or your head hits something else, or if the head is shaken, you can see how there is a movement of back and forth of your brain, and it can produce bumps and bruises on the surface of your brain. We're also going to talk about strangulation-induced brain injury. So when you are strangled, what happens is that there is a loss of oxygen to the brain. And when that happens, it can also induce a variety of traumatic events, which I'll explain here in a minute. So when I talk about brain injury in both of these cases, I mean either a traumatic brain injury where your head is hit, or brain injury due to a lack of oxygen due to strangulation. Okay, so let's first talk about, before we can figure out how a brain injury is a bad thing, let's talk about how your nervous system functions normally. So normally, our nervous system is composed of these cells called neurons. And in a normal brain, a signal can arrive at a single neuron, gets transmitted down this axon here, it's a long tube, and then at the end of the tube, it causes the release of a chemical called a neurotransmitter. You may have heard of like dopamine for Parkinson's disease or serotonin for depression. So when this neurotransmitter is released, it causes the next cell to pick up the information, okay? And it will then keep moving on and on, sort of like a game of telephone. So these neurons connect with each other, okay, to form circuits. Here's an example of a circuit. This is your brain cut in half, but these purple lines show you different circuits that are formed using the neurotransmitter dopamine. So for example, you can see that this circuit here, if it goes, the connections are happening here, this helps you move, whereas these connections up here can help you think. So these circuits are formed all throughout our nervous system, and hundreds and trillions actually of cells and thousands of circuits are involved in allowing us to do the things we do. Okay? So when a neuron is injured, and this can be due to the head being hit or due to a lack of oxygen due to strangulation, what happens is there's an imbalance. Certain chemicals rush out of the cell and are replaced with calcium, these little red dots here. And calcium is wonderful for your bones, but it's not great for your brain in too high of a concentration. So when there's too much calcium, what it does is it plays a role in the release of those chemicals, those neurotransmitters. So when there's too much calcium, all these neurotransmitters here rush out and start communicating to this cell. Now, this communication has to be such that very fine-tuned. So when there's a huge amount of neurotransmitters coming out, this cell just can't handle it, okay? And it interferes with the ability of the circuit to communicate. Now, when this is all happening, this nerve cell is really, really vulnerable, okay? And if you hit it again or get strangled again, it can cause more permanent damage. These cells can return to normal over a period of time, but it takes a while. And what we don't know is exactly how long. Okay. Now, another thing that can happen, this happens more with the physical injury to the brain by it being hit or shaken, is that the axons, the connections between cell 1 and cell 2 can be stretched and pulled, okay? Sort of think of it as a piece of licorice. You can pull it, but at some point in time, it gets stretched out and it can break. And this can basically cause a roadblock between one neuron to the other, and the communication can't get from cell to cell. Okay? So what you end up with is these different circuits start having blockades. Okay, so think of it as a big traffic jam or a road being closed when you're trying to get from point A to point B. And depending on where and which of these circuits are damaged, you can have a variety of symptoms. So when we like to think of a healthy brain as being wired for thought, right? Whereas an injured brain has broken circuits. And like I said, depending on where the circuits are broken, it can lead to a large variety of different kinds of symptoms. So if you look at all of these different symptoms, there's a lot, right? There's physical symptoms of a brain injury like dizziness or sensitivity to light or sound. There's sleep disturbances, either sleeping too much or sleeping too little. Problems with thinking and remembering, so troubles with concentrating, troubles putting your thoughts in order, feeling slowed down, feeling foggy, confused, having trouble remembering things. And then mood disruption, so feeling anxious or depressed or irritable or angry. And if you think about all these symptoms, these are ones that we all have individually at some point in time. And they're also symptoms that someone who is dealing with the trauma of being in an abusive relationship is also experiencing due to the psychological trauma of that abuse. So we like to say that if these symptoms are either new or if they get worse after someone has experienced a violent episode where they are strangled or where they are hit in the head, that is most definitely, those symptoms are most definitely due to the brain injury. So the good news is that these symptoms can be treated. The bad news is that there's not a magic pill for brain injury. But all of these symptoms are ones that can be addressed. They can be addressed through medications, right? For pain, for antidepressants, anti-anxiety, sleep medication, etc. And then other things can be addressed through therapy. Balance and dizziness can be addressed through physical therapy, occupational therapy, speech, cognitive, and of course, psychological therapy for mood disruptions. Okay, so people can having these symptoms can get help. The problem becomes with repeat concussions or repeat brain injury. This concept came to light when there was a larger incidence of trouble in individuals who were in contact sports, like in the NFL. And what they found is that these individuals, of course, with contact sports, receive multiple hits to the head over a period of time. And when this happens, what it does is it injures already vulnerable neurons, and it then prevents your brain from healing. So this can basically lead to an increased risk of neurodegenerative disease, things like Alzheimer's, Lou Gehrig's, Parkinson's, and something called CTE. CTE is chronic traumatic encephalopathy. This is your brain here, a normal brain, quote unquote. You can see, a nice bluish tint here. And then this is your brain after it has been hit in the head multiple times. And this is something called chronic traumatic encephalopathy. You can see this dark staining here. The staining happens in certain areas of the brain that are responsible for things like thought and memory and anger, etc. And it was first demonstrated that this is something that was seen mainly in boxers, but Dr. Bennett Omalu saw this type of disease in a middle-aged former NFL player who committed suicide. And since that time, in the early 2010s or so, Dr. Ann McKee's group has taken this and demonstrated that this disease is indeed due to multiple hits over the head over a period of time. And it's predominantly been studied in NFL players and athletes, contact athletes, and also in the military. However, we all know that, like professional athletes and soldiers, women and children are impacted by interpersonal violence are definitely more likely than the general public to suffer from brain injury. This intersection is one that really wasn't addressed or examined until about 2015. But since then, there has been a lot more attention put on this intersection. And that's what we're trying to do here in Illinois, and that's what we're trying to do here in this particular training. Okay. So intimate partner violence basically intensifies the impact of brain injury as a healthcare epidemic. You already know the data that about 1 in 4 women experience IPV in the US. So that's about 30 million women in the US. And I'm going to say women here for the rest of my presentation, not because I'm being sexist or non-inclusive, but the data that we have is more in women than in other groups. We know very well that this happens IPV happens in men. We also know that it happens in the LGBTQIA plus community. Unfortunately, the data that we have on it is very limited, which is something that needs to be addressed over time. In the world, we know that 1 in 3 women experience IPV, so that is an even larger ratio. We know also from our data that up to about 92% of survivors receive hits to the face and head during violent episodes, which of course will cause your brain to move around in its skull. So if you look at this data just in the US, if 92% of 30 million women are experiencing hits to the face and head, then we suspect that about 27 million will likely show signs of brain injury. So we think of this as a diagnosis of exclusion, meaning if someone has experienced intimate partner violence, most likely they have experienced some level of brain injury. The data also shows that the prevalence of brain injury in the context of intimate partner violence is about 11 to 12 times greater than brain injury that occurs just from riding a bike or being involved in a motor vehicle accident, et cetera. So it's much, much higher. And the problem is that the majority of survivors who show some symptoms of brain injury never really seek medical care. In terms of strangulation, we know that the strangulation in the context of IPV is very lethal, but it's common. About 68% of women in abusive relationships report strangulation. And it's hard to see, right? Just like with a brain injury, you can't necessarily see the external signs of that type of injury. And when someone is strangled, it results in a lack of oxygen and blood flow to the brain, called hypoxic ischemic brain injury. And the result is basically what you also see following traumatic brain injury. So the symptoms are very, very similar. And just like with traumatic brain injury, the majority of survivors don't seek medical care for their symptoms. Long-term consequences of being hit to the head multiple times over a lifetime are still being studied. Back in 1990, there was a paper showing that a woman who died due to her violence was someone whose husband had been violent towards her. And when they looked at her brain, basically they saw a brain that looked very much like CTE. Back then in the 90s, it was called punch drunk because it was something that was seen mainly in boxers. So in 1990, there was a hint that maybe something like this long-term neurological disorder can happen in someone following multiple years of abuse. Recently, in 2021, a case was demonstrated of a 29-year-old female whose autopsy was consistent with multiple brain injuries that she obtained in the context of her abuse. And unfortunately, she died due to her abuse and her brain was examined for pathology. And you can see here that even at 29 years old, she was already showing signs of CTE. So there's a lot of attention on CTE in the athletic community and little to none in the domestic violence and IPV community. And that's something that we're hoping to address over time. So our goals as a coalition are to do what we're doing right now, educate survivors and professionals who work with them on this intersection. We're also looking to take what we know about brain injury in athletes in the military and come up with effective approaches for survivors of intimate partner violence. And we're also trying to add to the body of literature on this topic. To do that, my colleagues and I co-edited a volume, 2 volumes in the Journal of Aggression, Maltreatment, and Trauma on this issue, which you can see here. It was supposed to just be one special issue, but they ended up with a lot of interest. So we ended up doing 2. And if you look at any of these articles and you'd like a copy of them, please let me know. And then recently, our colleague, Dr. Eva Lara, co-edited a volume in the Journal of Head Trauma Rehabilitation on the intersection of brain injury and intimate partner violence. And if you're interested in any of these, please let me know as well. Okay, so what are the implications of this intersection? Well, the first is that most survivors of intimate partner violence are not aware that their symptoms are due to brain injury. However, their symptoms can affect a variety of things that can affect their ability to get help. First of all, they can affect their initial interview by police or paramedics. If they are called to the scene of a violent episode, the survivor may not be willing to or may not be able to talk to them, and because of the brain injury she just incurred, causing her to have trouble hearing, trouble with all the lights and the noise, and she just may not be able to understand what the police and paramedics are asking her, and that may be interpreted as being non-compliant and non-responsive and not wanting to interact or talk about the abuse she just received. And then also the ability to access services. You all know better than I that in order to access services, someone has to be able to follow instructions, fill out forms, come to appointments on time, and follow through with things that they're told to do. This is very difficult to do if you've suffered from brain injury. And then lastly, your ability to make decisions regarding your family, regarding your abusers, that can be very difficult to do for someone who has had brain injury. Okay. So how do you diagnose it? Well, it's not easy to diagnose. Even if you go to the emergency room, all that's going to happen is you're going to get a CT scan, and all they're looking for is your brain bleeding. And if your brain isn't bleeding, then they send you home and they say you're okay. So it's not an easy diagnosis, but especially in domestic violence. There's not a blood test you can take, etc. So it's difficult. There are some tools, and I'm not suggesting that you all have to now diagnose brain injury, but these tools may be something that your organization might be interested in examining. The first is called the HELPS tool. This is an older tool that asks questions like, have you ever been hit in the head? Have you ever been seen in an emergency room, lose consciousness? You do not have to lose consciousness in order to have a brain injury due to strangulation or trauma, which is why this one's a little outdated. And then they ask if you have problems, and these are basically taken from some of the symptoms, okay? A tool that we like better is something called the CHATS tool that our colleagues in Ohio have developed and are currently evaluating. Here, it asks about choking. It asks about being hit or hurt in the head. It asks after you were hit, so looking at the symptoms after the incident, and then discussing some of the symptoms, and then asking also if you ever thought you should see a doctor. Okay, so these are just some tools, and if you click onto these, you can be linked to those tools if you're interested. Access to services. So even though there are services to address brain injury, it's challenging, right? Because there's multiple approaches, multiple medications, multiple therapies, and it's very, very individualized. So it requires, meeting with a physician, meeting with multiple therapists, etc. Okay. And we know that there are barriers to treatment. We know that in the population of IPV, that there's a general mistrust of health and legal providers based on previous interactions or the advice of the perpetrator. We know that survivors fear seeking help for consequence of losing guardianship of their children. So if they're diagnosed with a brain injury, is that something that a legal system will say, well, you have a brain injury, you're not fit to care for your kids, right? We know that survivors often choose resources that ensure their safety over healthcare, which makes a lot of sense. And then there are healthcare disparities. They were amplified since COVID, but they've always been there. And that there's inequity in access to services. And so because of this, one of the things our coalition is trying to do is to educate providers and demonstrate to them that there are needs of survivors with possible brain injury. Like I said, the brain injury itself makes it challenging for an individual to make follow-up appointments, find care, etc. But the other problem right now, and this is across the country, is that concussion clinics or clinics that address brain injury typically focus on sports concussion. So in Illinois, there's many local clinics and providers, but a lot of them are ones that really focus more on athletes. And so there is one in our area, though, at Swedish Hospital called Pathways. And so if you are working with someone and you suspect that they have a brain injury, this is a resource that you can reach out to. It's Maria Bellata is the director, and the link to the Pathways program is here, and a phone number is here as well. And basically this is a service, this is located at Swedish Hospital through the emergency room, and they provide pathways for survivors of domestic violence, human trafficking, and sexual assault. So in order to establish a community of care to address the needs of survivors with brain injury, we have to identify and notice that unlike care for athletes, their care is going to be different. They may have unstable social situation. They may need transportation and childcare. As I said earlier, they are focusing more on safety versus healthcare, so that needs to be considered. They will have trouble managing their care due to the brain injury and the influence of the abuser. It may not be safe for them to access services. So the data out there demonstrates that approach to care of IPV survivors needs to be multidisciplinary and team-based. And most importantly, it needs to have a guiding advocate. And this is something that is happening in Phoenix. Our partners there, they are training police officers, first responders, okay? When they go to a situation where there is domestic violence, they work to connect the survivor with a advocate who then helps connect them with a healthcare system. Once they're in the healthcare system and they have a plan of care, they are connected with an advocate who helps them navigate the care and also navigate the legal system. We don't have time in this presentation, but there is a Today Show segment. I will put links to all of these things in the video area. And this Today Show segment basically shows how this is working in Phoenix. Okay? That's what we're trying to do here in Illinois. That's why we formed the Illinois Coalition to Address IPV-Induced Brain Injury. We have a website. It's still a bit under construction, but there's a lot of basic information there, and it can lead you to other resources. So I invite you to take a look. Our 4 pillars are to educate, which is we do trainings such as this one. We will come to you or do a Zoom with you to educate your group or survivors on brain-induced, violence-induced brain injury. We're conducting some research We are working to create a community of care and provide services aside from Swedish hospital. And then we're also looking at advocacy, looking at how we can get more resources for domestic violence survivors. We partner a lot with the Ohio Domestic Violence Network, and they have a Center on Partner-Inflicted Brain Injury, which also has a great variety of resources that you can access. Okay, so what can you do today after this training? Well, first, I want you to be mindful of symptoms. If you're working with someone and they're having trouble with something, think through why they might be having that trouble and how you can address the issues that they're having. A lot of times working in an area that has lower light instead of big fluorescent bulbs can be helpful. Working in a quiet area that's distraction free. Really important to not do a whole 2-hour session with them, shorter sessions where they can focus on one thing at a time for 10, 15 minutes. It's really important to repeat information, review information, check in for understanding of information. Okay? Give really concrete instructions and follow up with them as best as you can. Okay? More specific examples can be seen here in terms of, if someone has difficulty with attention and concentration. So a lot of what we just talked about here, but also incorporating short breaks. If someone is having difficulty with memory, seeing if you can write information down and use a journal or a log. I know that sometimes that can't be done due to safety, but if there's a way to think about what strategies can be used for remembering important things and deadlines and dates and information. And here it's really important for repetition of information and creating some sort of a checklist if possible. Okay. If someone is having difficulty in executive function, meaning being able to plan out what they need to do next, talk about prioritizing goals. So instead of filling out 10 forms, what's the first form that needs to be filled out? Okay. Really reducing distractions. So quiet place if possible, and giving them a little more time to complete a task. Okay. And then write out steps. So if they need to go to an appointment, okay, how do you make the appointment? Who is the appointment with? Where is the appointment? What time? What date? How are they going to get there? Okay. What do you do afterwards? So writing out the plan. And then they may just have difficulty in processing and understanding what you're saying. So once again, focusing on one thing at a time, talking slowly, repeating information, taking breaks, and then talking in facts as opposed to abstract concepts. And then here it's really important to double check. Ask if she's understanding what you're saying. Ask her to repeat back what you just said, or ask her to say, what's the next step? What's the next thing you're going to do? Okay. So I know I gave you a lot here, but there are some great resources for practitioners. And these are provided by the Ohio Domestic Violence Network, their Center for Partner-Inflicted Brain Injury. This PDF here is wonderful. It basically goes through everything we just talked about. It's kind of a booklet for providers. And then here, this is a shorter document, and these are head injury accommodations. And this PDF basically says, okay, think about the symptoms the person you have are working with has. And there's for each symptom, there's a set of recommended accommodations you can consider. So this is a very helpful tool. Okay. Now there's also resources for survivors. The Ohio Domestic Violence Network has all kinds of brain injury materials. They have large booklets, they have simple cards, etc. We at the coalition have adopted their brain injury cards. These are in both English and in Spanish, and it basically is just it's sort of like a little bookmark, and they can take it and they can look at it and think about it. And then it also has a code here that can take them to our website where they can learn more. If you're interested in having a hard copy of this, we will have them downloadable on our website soon. but a hard copy is available if you just email me. These tools are ones that have been assessed, and the recent publication looked at how useful these tools are and what they are, how they are helping. And our group in Ohio provided these tools to 5 domestic violence service organizations. So a total of about 60 people were using them. And then they evaluated how they were used and their impact on the practice. And basically what the responses were is that when people were using these tools, they felt that they were helping to make genuine connections with survivors, to acknowledge that brain injury occurs, and that mental health struggles also occur during due to the brain injury. And it provided the providers tools to help educate, accommodate, and refer survivors. Okay. And those who use these tools found them to be helpful to educate themselves on how to provide a more comprehensive review of survivors. Okay, so at this point in time, if we were live, we would do a little breakout session where you would think about and discuss with each other 1 or 2 ways that you might implement what you learned today in your daily work. So if you're game, feel free to think about that and do that. But at this point in time, I would like to just thank you for your attention and your time. If you have any questions about this, feel free to reach out to me. Also, my colleague Sonia gives these presentations, and you can reach out to her as well. And I thank you for your time and for your attention. Thanks.